Hello, everybody. This is Tim Rowan. Welcome to episode 2 of our exploration of the National Healthcare at Home Best Practices Study. I'm sitting here with Lindsay Doak, the Director of Research for BerryDunn. And as we did last time, we're going to take one aspect of the study at a time. It was a very broad study that you all participated in and added your input, your successes, your experiments and best practices, so that Lindsay could take the data and analyze it, and it would take us hours and hours to go through it. So what we've done is broken this video up into several chapters. So here in episode 2, Lindsay, what would you like to talk about today?
Well, as I mentioned in the last session, we had an intake study or an intake survey that we surveyed people and we asked them what they would like to hear. And of the 30,500 responses, the number one we got was staffing. So I thought we'd focus on staffing today because I know that's a critical thing going on in the industry.
Yeah, critical was the term we used a couple years ago. Life or death is more the explanation that people are using since the pandemic. The ability to cover all of the patients and clients that you have is more difficult now than in my entire experience in home health.
Yeah, and you know, with the rest of the study, what we're seeing is that a lot of it comes back to staffing. You know, you can't incorporate these best practices or a lot of the other things that our organizations are doing without the people to do them. So staffing really is the core of what is incorporated into what becomes a center of excellence.
So what did the study find out? I remember you told me you had a phenomenal number of data points. And so I would think that what you learned about staffing would be significant and important to everyone watching us today.
We did, you know, the most interesting thing is to break it down by region. And so when you look at staffing as a whole, you think, okay, where are the pockets that organizations are struggling with staffing the most? And so we broke it down into the different areas of the country. And what we saw was that, you know, the majority of respondents did say that the impact of a staffing shortage was negative or extremely negative for their organization. So everybody agrees staffing is a critical issue. But we saw more people state that it was extremely negative as we entered the Midwest and the West Coast. So we're seeing a stronger impact on the staffing shortages in those regions than we are in the other areas of the country. So I thought that was pretty fascinating. And then if you drill into that, and that was for home health and hospice. And then for hospice, we also saw some critical staffing shortages in the New England and New York area, in addition to that West Coast. And then of course you can look at that a little bit further. And what you see is that those who have staffing shortages, as you would expect, have likelihood of having more than 10% of their clinician roles unfilled. And so you're thinking of these organizations, they're out there working, they have patients they have to deal with, and they have more than 10%, so 11% or higher, and in some cases, as much as 30% of their clinician positions unfilled. So it's just impossible to keep everything moving and running without those positions. And you then correlate that to the outcomes. So what happens when you have these positions that are unfilled? And of course, what you would expect is, you know, those organizations that have less than 10% of their clinicians unfilled have an average of a 4.5 star rating and a 4-star rating in patient satisfaction. So 4.5 for quality and 4 for patient satisfaction. When you get to higher than 20%, so you have more than 20% of your clinician positions unfilled, that quality of care star rating drops to a 2.5 and the patient satisfaction drops to a 2. You know, we're about to encounter value-based purchasing, value-based care. And I know a lot of people ask, you know, what are the factors that come into improving, especially patient satisfaction and quality outcomes and rehospitalization rates? And one critical metric, it always comes back to making sure that you have your clinician positions filled. So once you get above that 10% seems to be that key metric, you're seeing a significant decline in patient satisfaction and quality outcomes. So it comes back to the fact that this is just so critical, and it's interesting. So then you take a look at, what is causing the staffing shortage, and what we see is that there's actually no key to recruitment. So I would love to have a magic secret key to recruitment. I say, if you offer this amount for a sign-on bonus or these benefits, you will have a better job of recruiting. There are pockets of the country that have better benefits, New England versus the South. But I think that's just because of the higher cost of living and those sorts of things. But we didn't see that any correlation between recruitment strategies and number of positions unfilled. So it's just interesting to see that recruitment efforts, as much as we're doing, aren't having an impact on those positions unfilled. So there is opportunity.
So you could try, I'm sorry to interrupt. So I want to make sure that I understand exactly what you're saying. There are all of these consultants and all of these strategies and all of these efforts. And the people that responded to the BerryDunn survey told you about all of their different recruiting techniques. And you're saying that none of them make any difference?
They didn't. There was no correlation between benefits and sign-on bonuses and those types of things. So the things you would normally use to recruit, where you recruit. Basically, what we found from the study was that everybody is doing all of these things, so like everybody is offering sign-on bonuses, everybody is offering significant benefits, more benefits than we've ever seen historically with this industry. Everybody is offering the same amount of time off for their staff because they've all upped their game to try to help recruit nurses and clinicians into the industry. But we didn't see a correlation between any of those things, sign-on bonuses, benefits. Obviously, there's probably some organizations that offer significant benefits versus not significant benefits, and there could be something, but when you average it all out, we're not seeing a correlation between organizations that have those benefits and the number of unfilled position or recruitment. So as much as I would love to say that, yes, you should do X, we're just not seeing that.
Okay. So
then what does that lead to, right?
Yeah, yeah, exactly. What does that tell us? What kind of best practices does that? It almost sounds like you're saying that there are no practices that make a difference. So you have to look at retention. Is that the next step?
Yeah, it's all about retention. If you look at the retention rates, so unsurprisingly, it all ties into patient engagement. And so organizations that have patient engagement of 80% or higher, or staff engagement of 80% or higher have lower turnover rates. And those organizations that have turnover rates of less than 15%, so 15% seems to be that metric, have the most or the least unfilled positions. So it's turnover and making sure that you are retaining the staff you have in this critical market, and I think there's a lot of advocacy going on to where I know that there's a lot of the national associations that are really trying to help with improving the amount of nurses graduating from college going into home care. So that has to happen because we're going to get to a point eventually where we don't have enough nurses to fill the positions no matter what we do. But in that time period while we're working on that, you have to retain the staff you have. And then there's correlations between turnover and profitability. So what we saw was that organizations that have less than 10% or report that less than 10% of their clinicians and employees turnover have PDGM margins of 18%. Once that gets to 20%, that PDGM margin is less than 1%. So
that's a huge difference.
A huge difference. And when you look at, category by category, for every 1% increase in turnover that your organization has, it's almost a 1.2% drop in your profit margin. And so it's just so critical for a variety of reasons, for the quality, for the patient satisfaction. But we know that with the upcoming proposed rule, there's cuts that are being talked about. And if you are an organization in that 20% and your margin's 1% right now, it's going to be really difficult to continue to stay, running without staff and without those margins to keep you afloat. And so it just, I think we think a lot of retention is just like improving morale and making sure it's happy. But the retention is critical for the financial stability, the care of the patients, everything that an organization runs on depends on that retention and making sure that rate is less than 15%.
Lindsay, you started off talking about engagement, patient engagement, employee engagement. Do you have a not so much the definition, but a description of how to achieve or improve employee engagement?
It's interesting that you say that because we're actually working on a side project right now to see what metrics lead more of a qualitative study. This was a quantitative study, but we're working on more of a qualitative study to figure out which metrics really move the dial for engagement. But we did. So we correlated that, obviously we asked organizations if they do employee engagement surveys. So let's start there. You have to make sure you're conducting employee engagement surveys. So 100% of the centers of excellence, and we talked about that, those with the highest quality in patient family satisfaction and outcomes do employee engagement surveys at least every 12 to 18 months. And so if you're an organization out there and you're not doing that, that is the critical first step, because you're not going to even know what your engagement levels. And you'd be surprised, like 20% of organizations who respond to the survey don't conduct employee engagement or don't know if they conduct employee engagement surveys. And then when you take a look at the engagement surveys and how that correlates with the practices, so the staffing practices of the organization, number one correlation is the turnover of leadership. So we asked, how often do you turn over senior leaders? And if you are in that every 2 to 3 years, your engagement levels drop significantly and your turnover rate increased to an average of about 30%. And then when you got to that 6 to 8 years, so 6 to 8 years or more, so we had 6 to 8 and 8 to more, your engagement rates increased to an 80 to 90%. So that's 80 to 90% of organizations who say that their staff are very engaged. And then your turnover rate drops to about 11%. So there's a direct correlation to leadership turnover, which you would expect this, but it's interesting to see the data and see how this comes to reality, and employee engagement, employee turnover. And it goes back to what we thought, which is, that the number one reason an employee leaves their organization is because of their direct relationship with their supervisor. And so that turnover rate is critical.
So you have this dual-edged sword where your clinicians have relationships developing with patients and with their direct supervisors and the agency leadership, and they you want those relationships to be good in both up and down directions, but the nurse and the therapist and the other clinicians are in the middle of that, and sometimes bear the brunt of the responsibility to create those relationships. And as you say, what can they do when leadership changes?
Exactly. And when you look at it further, you talked about the patient, which is critical. You want to make sure that your patient satisfaction rates are higher. Those with higher engagement levels and those with less turnover have much higher patient satisfaction level. So it starts at the top. If it starts at the top and the leaders are engaged and the staff are engaged with the leadership, that's going to trickle down all the way to the patient and making sure that that patient is satisfied as well. And so just focusing on that relationship building with the leadership and building those teams is really critical for turnover, but also, trickling down to the outcomes and the patient satisfaction of your patients.
This becomes an issue that is probably among the most difficult to deal with. Leadership is going to change from time to time. Either people are promoted or they're lured away to a higher paying job, or they retire. It's always going to happen. Do you have any ideas on how to slow it down and reach that 6 to 8 year point instead of the 2 or 3?
And another question we asked on the study, it's interesting that you asked that, is that the majority of participants think there is going to be a major shift in leadership over the next 3 to 5 years. And then with home health, they think that shift is going to be pretty negative on the industry. Like it's going to have a dramatic negative effect on the industry. And then in hospice, they think it's going to be somewhat neutral. So we'll see, it's interesting to see how these go. The interesting thing about that is that within home health, about 70% of organizations are already implementing succession planning, strategic planning to try to plan for that. But within hospice, that's about 20%. So the hospices are planning for that succession, and the home health organizations are. And I don't know why there's that big disconnect there. But I mean, in addition to slowing down the turnover, I think, all of the leaders that have survived COVID, that are about to retire, that are about to encounter this new world of value-based purchasing and potential cuts, we're probably going to inevitably see a higher turnover rate over the next 3 to 5 years. It's just inevitable with everything that's going on and the age of leadership at where they are in their careers right now. So the key is making sure that transition is smooth. So the succession planning, having people, in the waves or second round are ready to step up so that transition seems seamless when they transition out. And it's not a big disconnect for the employees, because that's really probably what's causing that turnover rate, is having that disconnect with the employees to where they feel they should just move on.
So perhaps bringing a replacement in early so that they overlap with the person who's leaving, or promoting from within, you're saying might help. But in addition to those strategies, if and when they're possible, the other phenomenon that I see going on is mergers and acquisitions. The leadership changes when the company is acquired. I recently interviewed some people who were the acquired company, and they talked a great deal about not only leadership change, the new person that they're reporting to, who was probably across the country, but also policy changes that happen during an acquisition. Did the study take that into consideration as well?
We didn't ask specific questions about that, but we did have a lot of organizations that participated that were big in the mergers and acquisitions. So it was interesting taking a look at their data, and you could see, a mild lower employee engagement rates for those who are in high acquisition mode. So absolutely, organizations that are acquiring a lot of other organizations right now, that massive culture shift from going from one organization to another. And then also, the culture shift from going from a smaller organization to a bigger organization. And that's one of the things that we're going to be looking in this qualitative project that we're working on right now, is how do you maintain the feel? So a lot of it's about maintaining the feel of that smaller organization when you're a larger organization, so building those relationships. And we're in a remote workforce right now. It's not uncommon for leaders to be across the country, but how do you maintain that engagement when you're working in a remote situation? So that is something that we are definitely looking at in terms of the qualitative aspect of this research project.
Well, yeah, so it sounds like the acquiring organization has the burden of making sure that the transition is as smooth as possible to avoid the turnover that results from change in leadership.
100%. And I know a lot of them have really navigated this, and I've talked to some of the leaders who have navigated it well. But yes, if they're taking in another organization, how do they make that other organization feel like they're a part of the culture?
Yeah, there's so many times you hear about the representative, not the CEO, but the representative from the acquiring corporation holding a meeting saying, okay, everybody, this is how it's going to be from now on. And
that's not,
there have to be ways to do that.
Well, going back to that, when you do look at other data points in the study in terms of engagement, it's things like they feel heard, they feel listened, they feel like their input is valued. You promote from within. You know, a lot of times it's you're measuring the diversity of your staff to making sure that the diversity of leadership represents the diversity of your staff, and also, of course, trickles down to the patient, you know. So a lot of organizations who are doing all of those things have higher retention rates because the employees feel like they're being heard and thought about as part of that process.
You've used that word feeling more than once. It's hard to measure, isn't it?
Yeah, it's really hard to measure. You know, engagement. You know, if there was a key to an engagement and dealing with human nature and all the different personalities, I think that person would be a multi-millionaire. I mean, you know, I know there's a lot of strategies out there, but it's really getting down to the individual, where they're at, with their skill, where they're at in terms of their engagement to the organization, and working with an individual. There's no out of the box solution that's going to work for all of your employees. You're going to have to really target it to the individual. Somebody might like to be heard and speak in meetings. Another person might really value the diversity aspect of it. But that's where the communication comes into play, you know, making sure that you're regularly communicating with your employees, you're asking them, in addition to the engagement surveys, just ensuring that you have that regular stream of communication going on.
Before we run out of time, I want to make sure that people get a framework for what it is that we are exploring here. This is episode 2 of a series of interviews with Lindsay Doak, who is the research director for the National Healthcare at Home Best Practices Study. There's a lot more to this, of course, than recruiting and retention, right, Lindsay?
Yeah. So what we talked about before was that there are major categories that we've divided the study into. And so if you do, or you did have a chance to download the report, you'll see those. Staffing, recruitment, and retention is one of those categories. So we covered that today. We also have home health best practices, hospice best practices. So by best practices, we're talking about operationally, clinically in your organization, what are you doing to ensure higher quality, satisfaction, and reimbursement. And then technology was a critical area. So EMR, telehealth, discussions, palliative care, which is the Wild West of healthcare right now. So really trying to drill into what are those organizations. You know, palliative care has a million definitions for what palliative care is, but is there something organizations are doing that offer palliative care that ensure that they're doing it successfully, and that trickles into their other outcomes as well. And then the last one was the public perception of home health and hospice.
So we'll explore these one episode at a time, but we cannot explore them in detail in the 20-minute segments that we have been providing here. So how do people access the entire study if they want to dig into the weeds and explore all of the findings that you gleaned from these 400-some thousand responses that you got?
And we're still gleaning, let me tell you. So we have a few. The direct correlation between the retention and the profitability is something we just discovered last week. So that's an exclusive for you, Tim. We have the full report. So the full report is available on our website at BerryDunn.com. So BerryDunn, the sponsor of the study, did a phenomenal job in helping put this all together. And then we also have an interactive portal. So there's information in that report. And as we have new insights that are released, those will be released in that portal. And all of this is complementary to the industry because we really want to help organizations. There's a lot of challenges coming, and we want to help organizations thrive in this changing environment.
Well, it sounds like with this volume of data that it is going to be very helpful. I didn't mean to say 400,000 responses a minute ago. 400,000 data points is what you got out of the responses from participants in the survey. So next time we will pick one of those categories, maybe like this time, one that you just, with data that you today don't know yet because you're constantly analyzing. So I would love to tell our viewers which category we're going to be talking about next time, but let it be a surprise because you are constantly learning more from the data, correct?
We are, and you know, everybody loves a surprise. So this is like the Game of Thrones of home care data. So yes.
Except nobody dies.
No one dies in this. No one dies. It's a very safe,
So,
clean show.
okay, so as we talk between now and the time that we record the next conversation, you can let me know what you've learned that's new and exciting, and that will be the topic for next time. But by the time we end with this series, we will have explored all of the categories that Lindsay just mentioned. So I hope that all of you will keep an eye on Home Care Tech, the Rowan Report, for my announcements of when each of these episodes is released. And we will keep them coming every week or two for the rest of the year until we finish exploring the study. So Lindsay, one more time, if they want to read it in detail, it's BerryDunn.com. That's
Yes.
2 R's and 2 N's, BerryDunn.com.
Yes. RRYDUNN.com. Yes.
Terrific. And of course, you can find my newsletter at homecaretechreport.com. And if you're not a subscriber, there's a button there that you can use to subscribe. So, Lindsay, I can't thank you enough. This has been extremely informative, and I'm sure there's even more when people look up your study and take a detailed look at the results. So thank you very much, Lindsay. Thank you all for joining me. This is Tim Rowan. This is episode 2 of our exploration of the National Healthcare at Home Best Practices Study, and we will see you next time.
Thank you.